The option to report PQRS measures through a measure group is only available for individual providers and will most likely be selected by smaller practices. If a provider successfully reports on a measure group, she'll earn both the 2014 PQRS bonus and avoid the PQRS penalty in 2016. A measure group is 4 to 9 measures that are each applicable to a defined population of patients, for example, diabetics or patients with low back pain or those with rheumatoid arthritis. For each provider, you'll identify 20 patients that meet the denominator criteria and were seen in 2014. You'll purchase a registry software program, which usually provides a worksheet for you to complete on each of the 20 patients. 11 of the patients must be Medicare fee-for-service. Be sure that you don't include any Medicare Advantage beneficiaries among these 11 patients. You'll enter the data from the worksheets into the registry via the web, and the registry will submit the data to CMS for you during the first 2 months of 2015. Most registry programs charge a fee of $300 to $500 per provider. Here is the list of measure groups available. If one of these seems to apply to your patient population, you'll want to carefully review the definitions and measures that are included. These can be found on the CMS website in the Measure Group Specification Manual. Next, explore registry programs that offer reporting of this measure group. The CMS website will be posting a list of 2014 approved registries around June of this year. Features that will be important in a registry program include cost, how easy the program is to use. For example, is their data entry tool clear? Can you upload the data from an Excel spreadsheet? Or similar issues. You'll also want to check the availability and quality of their support and the timing by which you must complete the chart review and submit the data. Data must be submitted to CMS by February 28th of 2015. However, registries may have different deadlines for completion of the data entry. There are dozens of registry programs, but here are 2 that some of our clients have used successfully. Also check with your EHR vendor, as some have relationships with specific registries that can reduce your data entry time or your costs. The American Board of Family Medicine and the American College of Surgeons each offer a registry for members at no charge, but these only offer one of the measure groups. Check with your association to learn what they offer. Even though you may complete your chart review toward the end of the year, it's useful to identify which measure groups you'll be reusing and to develop mechanisms to capture the necessary data in a consistent and convenient way. For example, you might create a template or a flow sheet in your EMR that collects all the necessary information and can be easily retrieved to complete the data required by the registry program. You can choose to capture data for all patients throughout the year and just choose 20 to enter into the registry, or some practices pick a start time and have providers or nurses complete a paper copy of the data entry sheet as patients are seen, and then stop once they've reached the 20 required patients. Remember that you must have a performance rate greater than 0 on each of the measures in the measure group in order to avoid the penalty. This means that on each measure, at least one of the 20 patients that you include must meet the performance criteria that would indicate high quality.